say she has some sort of surgery, cyst removal, or some business. I'm gonna check my orders. Oh, and that's another thing. Did we talk about like a surgery dressing? So say this patient comes out from surgery and has this dressing on. When do we remove it?
First, the surgeon's orders.
The surgeon is probably always going to be the one to remove the first dressing unless he requests you remove it, because they always want to see their handiwork. They always want to look at it and be like, oh yeah, that looks good. You know, sometimes I'm like, okay. And a surgical wound is what kind of wound? You got the, what's it called? What kind of wound you got?
Oh, I know what words we're looking for.
Primary,
Secondary, and tertiary.
Yeah.
That was primary.
I knew it was boy.
She knew it was first. I think I heard her say it, think it. Okay. So I checked the orders. I know what kind of dressing he wants. He wants a moist dressing. He wants us to use a saline solution. I've looked at it and looked at the measurements from previous. If this is not the first time, just to see what it looks like. I've also checked allergies, and I know when I left here, I was like, hey, we didn't really look at that. But why is checking allergies a good thing for a patient?
Some are allergic to tape, and so you might.
Latex on the gloves, yeah.
Latex, tape, the adhesive on tape.
I
Yeah,
had
so,
a patient allergic to chlorhexidine last week.
yeah. So you just, because some wounds you do clean the peri areas with chlorhexidine now a lot. So you just want to make sure they don't have any allergies to any of the stuff that you're using. If they do, then you need to find out what's acceptable to replace with that, okay? So I've got all that information. I come in and I say, hi, I'm your nurse today, and I notice that you need a dressing change. Can you tell me your name and your date of birth? So I've identified her times 2 identifiers. So how is your pain? I noticed you hadn't had any pain medication in a while, Ms. Miller. It's a 2. Okay. Do you think you'd be okay for us to go ahead and do this dressing without any pain medication, or do you want to go ahead and get some? I always ask, because it could be very painful, even though she's just a 2 now, she may still not tolerate the dressing change very well, right? Okay. She says she's fine. We're going to go ahead and do it. So I'm going to gather all of my supplies. I'm going to do hand hygiene. I'm going to put on clean gloves. I'm going to make sure that my wastebasket, receptacle, or plastic bag, whatever I have, is within my reach. I'm going to position my table in a comfortable position for me. I'm going to raise the bed. I'm going to make sure that the patient is as comfortable as possible. If I did have to medicate her, I would wait an hour for oral, 15 to 30 for IV pain medication, okay? So I did hand hygiene, I positioned the patient, I've donned my clean gloves, and the first thing I'm going to do is I'm going to remove this dressing. If the adhesive is sticking really bad, you can take alcohol or even saline around the edges sometimes. That's okay. Sometimes saline if you need to. And I'm going to try to pull out everything as I go. Now, if you notice that the dressing is sticking to the wound bed, you can use some saline to help remove it, but try to not jerk it, but try to kind of just lightly pull it off so you don't want to damage any of the good tissue that's in there. So I am looking at the dressing. I'm assessing it for coca, color, odor, consistency, and amount. What should it look like right after surgery? What kind of drainage should we have?
Serosanguinous.
Serosanguinous. And what if it's a few days after surgery? What should it look like?
Serous.
So sanguinous is bloody, right?
Mm-hmm.
So right after, huh? So right after surgery, it should look like what? Sanguinous. And then a few days after, it might look like what? Serosanguinous, because then you start getting the clear mixed with the bloody. There's less blood, more clear. And then a few days out, it should look what?
Serous.
Yes, because I'm serous, right? So, sanguinous, serosanguinous, serous. Okay? I'm making sure they're like noticing if there's any foul odor. What the drainage looks like. Is it sanguis, serosanguinous, or serous, or is it yellow? Like, what is it looking like? And then I'm going to say, please, not really. And I'm going to throw that away. Okay. So I'm just going to go ahead and I'm going to do hand hygiene just in case I got anything on my gloves. And I'm going to take the gloves off, wash my hands, put on clean gloves. Because I'm going to touch some of the supplies. So if I have anything on my hands, I don't want to get it on the supplies, right? So the next thing we're going to do is find Amy some tape. Behind me. Okay. So I go ahead and clean my table. And I put this stuff in the order I'm going to use it because I'm going to tape my cotton tip applicators down, okay? Because that helps me. And let me show you what I mean by that. Okay. So things are hard to manipulate, especially in these packages because they want to slide around the table. I've noticed that you start doing all the things you can do to help give yourself a free hand. So I usually, I'll move these down this way. So I usually take a piece of tape and just tape that down. See, it doesn't slide as much. And then, did I tape the wrong side? Miss Ludington did, I believe. So I'm going to tape that down. And then I'm going to open, maybe if I can open this part. And I'm not going to open it up all the way, but I am going to tape it down to the outside of the package. Because that's going to help me manipulate this. So when I pull one up, I don't have to worry about the whole thing coming up and contaminating, right? So I've got on my clean gloves. And now I'm going to measure, right? So I'm going to measure from head to toe is the what? Length. Yes. So I'm going to measure the whole entire wound out. Still don't have a good measuring tape. So this is about 8 plus 6.5, so we're going to say it's like 13.5. I think I get a different number every time. So then I'm going to do the width, and the width is the what? The widest part of the wound bed, okay? So we're going to measure that. We're going to measure that to that. It's about 2 centimeters. And then I'm going to measure depth. And I believe that's probably the deepest. And that looks to be about 2 centimeters. And then I'm going to probe around the base of the wound for tunneling. And we all know that there's just one little deep spot over there. We're going to call that tunneling. We're going to measure the tunnel. And that appears to be 2.5 centimeters. And then I'm going to check for undermining. That's a separation of the layers of the tissue. So it's more horizontal than it is vertical, okay? Once that I've done that, and I have thrown this away, I'm going to write down my measurements, okay? I'll have a pen up here or something. I'm gonna write down my measurements so I don't forget them. Okay, next thing is there a check somewhere? Here's one. I'm going to place a pad underneath my patient. And I'll say, is everything okay so far? I didn't hurt you too much, did I? And she's like, no, you're so sweet. And we are going to irrigate, right? See how the flow goes? So I still, if I have anything, I notice I have anything on my gloves because I don't want to touch any of this stuff. So I could go ahead and wash my hands and don clean gloves again because now I'm working with other. This should be in a container and this should be sterile, right? This part should be sterile. Inside where the piston is should be sterile, so we don't touch that. This is sterile solution. I look if it's not open, I make sure it's not expired. If it has been open and I notice it's greater than 24 days or 24 hours, I throw it out. If I'm opening it on the label, I will time, date, and initial it, okay? If it's already been open but it's not expired, past that 24 hours, I am going to palm the label because that keeps any kind of solution dripping on there so it does not smear any of the documented time or initials or whatever. And then I'm going to take the lid off. I'm going to turn it upside down and I'm going to make that, I guess it's a backwards Nike check mark swoosh, and I'm going to swoosh it over top of the trash can, okay? That's just getting all of the possible contaminated liquid off the top, okay? Then I'm going to lift up my syringe and I'm going to pour my solution in there, okay? I'm going to drop this back down in there without touching the outside anywhere because now that we've taken it out of the sterile package, this is clean but not sterile, okay? Then I'm going to note which part is dirty, which part is clean, because that's gonna be how I irrigate. So I am going to say that the distal portion of this wound is dirty. Just make it easier on myself. And I'm gonna irrigate from the top to the bottom. So I'm gonna pull up my solution, which is not easy sometimes. I'm gonna pull that up. I'm gonna touch these and this, only those two things. And I'm gonna be about an inch away from the wound bed, and in a steady stream, I'm gonna irrigate. And I'm gonna irrigate until it runs clear. If I have to keep going back and getting more, I will go back and I will get more. Never touching the inside of the piston or this part here, because this part here is going to go inside there, right? So we don't want to contaminate it. So I'm going to irrigate some more. Okay, everybody clear on irrigation? I'm also going to note what it looked like after I irrigated. Because we saw what it looked like when it still had all the slough and all the other stuff in there. So if there was any yellow stuff in there or anything that looked like with a little bit of water pressure is going to come out, then I'm going to note, oh, hey, underneath all that, this tissue is beefy red, but I still see some eschar or some dark black areas, okay? Okay, so now that we've irrigated, I probably splashed water all over myself. Is it wrong to wash your hands and change your gloves a bunch? Right, because it's never wrong. It's never wrong to be clean, okay? So you could stand here and say, is it time efficient? Not really, but it's your time. You just want to be clean. You don't want to contaminate everything. Okay, so I'm going to wash my hands. I'm going to put on clean gloves again, and I'm going to set up my table. I've wiped it down. I've made sure that these packages are the type of packages that you can pour solution in if needed, and that they're all sterile, because they have to be in these pull apart packages. They can't be just in the paper packages if you're going to do aseptic technique with sterile supplies, okay? So, I am right-handed, so I'm gonna start from left to right. Does anybody know why?
Putting your arm over here.
Yes,
The open things.
because if I decided I was going to hold it with my right hand and open it up with my left, then my elbow is automatically over something that's sterile, correct? So I want you to think about that. If you are left-handed, you want to go, it's just easier to go from right to left. If you're righty, you go from left to right. I got any lefties in here? No? Okay. I had 2 in the last class. So I'm gonna pretend to open this up. And you can do this with clean gloves. You're not sterile at this point because you're touching the outside of the package. And you have that 1-inch border here on all the packages that you can still touch, okay? Somebody wanna give me like a size 6 or 6.5 glove? That would be awesome. So I'm just opening. That sounded healthy. And then I'm opening, making sure that this stays open. If it does this, then what? It's contaminated, then you tell me what? I get another package. Okay, so it's open. What happens if I do this?
It's contaminated.
It's contaminated. Thank you, dear. And then I open. So I'm gonna make sure that I push all of this down here. You can manipulate your table any way that you need to afford yourself the space that you need. So my recommendation is to remove anything off this table that you are not going to use. So we don't want to have like all of this stuff up here because we've done irrigated. We don't need this, okay? You can even remove your tape. You don't need it right now. So, but you do need your saline. So I'm gonna look at it once again. Has it been opened? If it has been opened, has been time date initialed, is it still within the 24-hour period? If it's brand new, I'm gonna time date initial it. I'm going to palm it if it's already been open. I'm gonna lip it. Or if it hasn't been, I'm going to saturate these. I'm not gonna go in like this. I'm not gonna go in like this, even though I'm really not over anything sterile. Your sterile field is always in, out, in, out. You must be listening to lullaby music. Lullaby music?
No.
Okay.
No.
So I'm going to pour my saline solution over that, saturate those. Now, I need to take off my clean gloves. I can do hand hygiene again, let my hands dry, and then I'm going to don my steriles. Everybody with me so far? So, I'm going to, you see where it's kind of like perforated? That's your 2-inch border. That's the border that you can touch, okay? Oh Lord, this one's a cluster. Okay, so I'm going to pinch. And I'm going to slide that on. And then this is the thing, a lot of people want to, if it's stuck to the package, they just want to try it with one hand because they think you've got to touch it with just the sterile hand, but you've got this 1-inch border or 2-inch border. So you can hold this so this thing don't walk all the way around your table and then possibly contaminate all your other sterile things, okay? So you can hold that, walk your fingers underneath. And slide that baby on crooked. But since it's sterile, you can touch sterile to sterile, right? So I can slide this cluster mess, try to around. Good If it's rolled up, too bad for that. But you can hook your finger underneath of the cuff and pull it out if you want to. You can do the elbow, or you can simply just pick it up and you can drop it, as long as you're not dropping your hand below your waist. That's another thing too. Make sure that your table is waist height, okay? Because you don't want the table to be lower, because everything you touch then is contaminated, not sterile. Everybody with me thus far? Okay. So now we're gonna clean. So I saturated these with sterile saline, and I'm going to squeeze out the excess, and I'm going to go top, left to right, drop, squeeze it out, bottom, left to right, drop. And then if I notice it's kind of oozing in the middle, I can take this and I can pat, trying to kind of soak up some of that discharge, or whatever you want to call it. Okay, so now we want to dry, correct? So with drying, we're just going to pat. We're going to pat and drop. And then if we need to take another and kind of blot it for excess, we can, but I'm just gonna say no to that. I'm still sterile, okay? So I'm gonna take this one, I'm gonna squeeze the excess out. And I'm gonna do what's called fluffing. This thing should be bigger. But it's so, we're just gonna say it should be a 4x4, so it should be really huge, but I think it's been manipulated enough. So I'm gonna drop this in my non-dominant hand, and I'm kind of gonna feed it up through there. This is where this hand becomes
Non-sterile.
just clean,
Oh, yeah.
non-sterile, because I'm going to touch this because I touched it with clean gloves earlier, right? Okay. I'm going to take this finger and this cotton tip applicator, and I am going to cover the surface area of the wound bed without packing it tightly, because I don't want to blanch out the tissue, because we talked about that. What does that cause? And then if you cause injury, what kind of injury can it cause? So you can have more tunneling. You can have, because you're going to obliterate that, you can get eschar. You can create tunneling, eschar. You can do all kinds of damage by packing it in there tightly. So if you do have excess, like of course this is going to be, like I said, you can get some of the sterile scissors from a suture removal pack. You'd have to set it up and utilize it the same way that you set all of your sterile supplies up, and you could cut off the excess, okay? But we're just gonna say that this is absolutely perfect. You wanna make sure that none of this wet gets on your dry, because you don't wanna macerate the surrounding tissue, because then we're gonna cause breakdown as well, okay? Okay. So now I'm going to use these to cover the top, because that's just going to give us a little extra padding for any drainage, so we don't saturate the bed or whatever. So where I drop it is where it lays. Okay. And then I pick this one up where I drop it.
Let's see.
And on a rigid mannequin, sorry, it's not so easy. I didn't do that, boys and girls. Then you want to pinch up your ABD. You're gonna lay it over the top, so wherever you lay it is where it should stay as well. At this point, your whole sterile procedure is done, right? So if you have a hard time manipulating the tape, I just go ahead and pull off these tight gloves. I time, date, and initial piece of tape. And you can put that piece of tape, you can do a separate piece of tape and put in the middle, or you can just do it on what you're pulling off to tape this down. You want to make sure that this doesn't happen. On a normal patient, this would not happen. So all of this should be stuck in there, shouldn't be laying out, because you want to make sure that this is fairly airtight for the patient, because you don't want any microbes or anything sneaking under that dressing, correct? So you're just going to do a 4-sided tape. Okay, it just looks so pretty. Then I'm going to do hand hygiene. I'm going to clean up my area. I am going to assess how the patient tolerated it. Ms. Miller, are you okay? Do you feel like that you could have used more pain medication during that procedure, or do you feel like you tolerated okay with what you had, if I gave her anything? If I have to give her something, of course, I'm going to come back and I'm going to reevaluate her pain to make sure the pain medication that I gave her post-procedure worked. I am going to reposition her for comfort. I'm going to make sure that when I remove this, I still have my gloves on, of course. I'm going to cover her up. I'm going to put the bed down as close to the floor as it will go. I'm going to put her head up or position her for however she wants. Table within reach, call light within reach, all personal belongings within reach. And then I'm going to document.